Donda West. On the morning of November 9, 2007, Donda West arrived at an outpatient surgical center in the Beverly Hills area of Los Angeles. She was 58 years old, a college professor, and the mother of one of the most recognized musicians in the world. She had scheduled a combined procedure, a breast reduction and liposuction. The center was quiet at that hour. The intake paperwork had been completed in advance. In the weeks before the appointment, she had sought preoperative clearance from more than one physician. At least one had declined to sign off. Notes in her medical file referenced concerns about her cardiovascular health. She had pushed forward and found a surgeon willing to proceed. Dr. John Adams operated on her that morning. The surgery lasted several hours and concluded without any recorded complication. By the evening, she was home. A private nurse had been arranged to manage her overnight recovery. The house was still. Nothing in those first hours after she came through the door suggested what was already taking place inside her body. Sometime before midnight, the nurse found her unresponsive. Paramedics arrived. They were unable to stabilize her. She was transported to a nearby hospital and pronounced dead. The Los Angeles County coroner listed coronary artery disease and post-surgical complications, among them a fat embolism, as the cause of death. John Adams appeared on a nationally televised morning program within days of her death. In 2011, he surrendered his California medical license. Joan Rivers. On the morning of August 28, 2014, Joan Rivers walked into Yorkville Endoscopy on East 93rd Street in Manhattan. She was 81 years old, still doing stand-up comedy, still appearing on television, still booked months in advance. She had come in for a routine endoscopic examination of her throat. Her personal physician had accompanied her. The procedure was expected to take less than an hour. The facility was small, staffed, and accredited. Rivers was taken into the procedure room, given sedation, and positioned on the table. The monitors showed her vital signs. The room was arranged the way it would be for any standard outpatient examination at a clinic like this one. Then, during the examination, a staff physician began working on her vocal cords with a scope, going beyond what had been formally authorized. A biopsy was taken. Her personal physician also performed an examination while Rivers remained under anesthesia. The combination of interventions pushed her oxygen levels below a safe threshold. Her saturation began dropping. The team called a medical emergency. She had gone into cardiac arrest. An ambulance transferred her to Mount Sinai Hospital several blocks away. She did not regain consciousness. Joan Rivers died on September 4, 2014, 8 days after the procedure. She was 81 years old. The clinic's medical director later surrendered his license. The facility was cited for multiple violations and subsequently closed. Olivia Goldsmith. On the morning of January 7, 2004, Olivia Goldsmith arrived at Manhattan Eye, Ear, and Throat Hospital on the Upper East Side of New York City. She was 54 years old and one of the best-selling novelists of the 1990s. Her most famous book had followed a group of older women whose wealthy husbands left them for younger ones. It had been adapted into a film. She had come in that morning for a chin tuck, a minor cosmetic procedure performed under general anesthesia. She had no known serious health conditions. The operating room was prepared. The anesthesiologist administered the sedative. For a brief time, the room was quiet in the way operating rooms are when everything is proceeding on schedule. She was positioned. The monitors ran. Then her body did not respond the way anyone present had expected. Within minutes of receiving the anesthetic, she lost consciousness in a way that did not align with the intended sedation. The team recognized something was wrong. She was moved to intensive care. She did not wake up. Olivia Goldsmith died on January 15, 2004, 8 days after she had walked into the hospital for what she had been told was a simple cosmetic appointment. The hospital and its anesthesiologist faced civil legal action in the years that followed. The particular irony of her death was noted widely in the press at the time. Solange Magnano. On November 28, 2009, Solange Magnano arrived at a cosmetic clinic in Buenos Aires, Argentina. She was 38 years old, a former beauty queen, and the mother of triplets. 15 years earlier, she had won the title of Miss Argentina. The procedure she had scheduled was a gluteal augmentation, an injection-based treatment intended to alter the shape of the buttocks. The clinic was private. The appointment had been arranged weeks in advance. The injections were administered. She remained at the clinic for monitoring. The staff observed her, and her initial condition appeared stable. Nothing about the first hour following the procedure indicated what had already been set in motion. Then her breathing became labored. The filler substance had entered her circulatory system. Her team escalated quickly, but the material had already reached her lungs and shortly after, her brain. She lost consciousness. Emergency services were contacted. She was admitted to intensive care at a Buenos Aires hospital. Solange Magnano remained in a coma for 3 days. She died on November 30, 2009. Medical examiners confirmed that the injectable material had caused a pulmonary embolism and irreversible neurological damage. Her husband gave a public statement afterward. He described the morning she left for the clinic, saying she had kissed each of their children before she walked out the door. Stella Obasanjo. On October 23, 2005, Stella Obasanjo checked into a private clinic in Marbella, on the southern coast of Spain. She was the First Lady of Nigeria, the wife of President Olusegun Obasanjo. She had traveled specifically for this appointment. The procedure was a liposuction operation. Marbella had become a quiet destination for private cosmetic procedures arranged outside a patient's home country, and the clinic was set up to handle this kind of work. The surgery began that morning. Spanish staff managed the procedure. There is no public record of any formal concern raised before or during the operation. For a period of time in that operating room, there was nothing to suggest that the outcome would be anything other than routine. Then her condition changed on the table. The team responded. She went into cardiac arrest. Resuscitation attempts continued for an extended period and were unsuccessful. Stella Obasanjo was pronounced dead at the clinic on October 23, 2005. Her body was returned to Nigeria, where a state funeral was held. The Nigerian press covered the story in significant detail. A Spanish court later opened a formal investigation into the clinic and the circumstances of her death. Claudia Aderotami. On the evening of February 7, 2011, Claudia Aderotami checked into a Hampton Inn hotel near Philadelphia International Airport in Pennsylvania. She was 20 years old and had flown from London specifically for this appointment. The procedure she had arranged was not taking place in a clinic. It was taking place in a room on one of the hotel's upper floors. A woman named Paige Victoria Winslow had agreed to inject silicone into Claudia's buttocks for a fee. Winslow had no medical credentials of any kind. The hallway was ordinary. The room was ordinary. The materials Winslow used were not medical grade. Claudia lay on the bed and the injections were administered. Winslow had been operating this way for years, moving between hotel rooms and private apartments across a network of unlicensed procedures that investigators would later map in detail. Then, within hours of the injections, Claudia began struggling to breathe. Those with her called emergency services. She was taken by ambulance to a nearby hospital, where physicians found silicone migrating through her bloodstream toward her lungs. Claudia Aderotami died on February 7, 2011. She was 20 years old. Paige Victoria. Winslow was arrested, tried, and convicted of third-degree murder in 2015. She was sentenced to between 10 and 20 years in prison. Hang Myoku. Hang Myoku's first cosmetic surgery took place in South Korea during the 1980s, when she was in her 20s. Over the following years, she returned to surgeons repeatedly. The procedures changed her face incrementally with each visit, and eventually surgeons in South Korea began declining to operate on her further. They told her there was nothing more that could safely be done. She did not accept this. Unable to find a physician willing to proceed, she obtained a syringe and injected cooking oil directly into her own face. The tissue absorbed the substance. Her cheeks, nose, and jaw began to expand and distort around it. The change was visible from a distance. She continued. By the time a South Korean television program broadcast her story in 2008, her face had swollen to a volume far beyond its original proportions. Viewers who watched the program sent in donations. The funds were used to pay for a series of corrective operations at a hospital in Seoul. Across those procedures, surgeons removed a significant quantity of hardened and displaced material from her face. She survived. The corrective surgeries reduced the disfigurement substantially, but the alteration to her features was permanent. She has appeared in Korean media on multiple occasions since, speaking about the years in which she was unable to stop. Micheline Charest. On the morning of April 14, 2004, Micheline Charest arrived at a private cosmetic surgery clinic in Montreal, Quebec. She was 51 years old and had spent the previous 2 decades building one of Canada's most successful children's entertainment companies. Cinear, the studio she co-founded, had produced animated programming broadcast in dozens of countries throughout the 1990s. She had no serious health conditions on record. She had come in for a facelift. The clinic was accredited and had handled procedures of this kind before. The surgical team prepared the room. General anesthesia was administered. The table, the monitors, the sequence of preparation, all of it followed the standard procedure for elective cosmetic surgery at a private facility. Then, during the anesthetic phase, her heart stopped. The team attempted resuscitation. She was transferred by ambulance to a hospital, where efforts continued. She did not respond. Micheline Charest was pronounced dead that same day, April 14, 2004, within hours of walking through the clinic's door. She was 51 years old. Her death was ruled accidental. The cause was listed as complications arising from the anesthesia. She left behind 2 children. At the time of her death, Sinar was already under investigation for a separate financial fraud. Her absence from those proceedings was noted in the Canadian press for years afterward. If you liked this video, hit subscribe for more like it, and let me know in the comments what you want to see next.